So today we're going to discuss heart rate variability in the context of a baby suffering a traumatic brain injury at birth, an HIE brain injury, from a medical legal standpoint. And the idea is to help you're watching this video, understand a lot of the key areas that birth injury lawyers like myself, that we are reviewing and assessing when a family is looking for answers as to what caused their baby's traumatic brain injury. It could be genetics, it could be developmental, but also medical malpractice in some instances is what causes these babies to have these types of traumatic brain injuries. And baseline variability is crucial, and it is important in understanding what may have been going on or what was going on during labor and delivery. So baseline variability is the fluctuations in the fetal heart rate of more than 2 cycles per minute. That's what it is. These fluctuations, they are graded from top to bottom. And when we drill down further, I'm going to discuss quickly the 4 types of variability that can be seen. So the first one is going to be absent variability, and that's going to be no detectable range. When the monitor is going, there's no detectable range. Number 2 is going to be minimal variability, and for minimal variability, you have less than 5 beats per minute. It's going to get you minimal variability. Moderate variability, which is the good one, is going to be anywhere from 6 to 25 beats per minute. That's going to give you moderate variability, and marked variability is going to be greater than 25 beats per minute. Now, this is my little handy dandy drawing this down here, and you got to forgive me because I know it's not the best, but hopefully what you can see is, remember I said that when these fluctuations are graded, they're graded from the top to the bottom. So if we take a look down here and we look at this, my crude drawing of a fetal heart strip, we can see in this area, we've got the top of this drawing for this reading is going to be at about 150 beats per minute. And it drops down in this process. It goes down to about 140. If you can look and see, this is 120, 30, 40, 50, 60, 70, 80. So we're in 10. Each one of these lines is going to represent 10. So we've got about 150 up here, and then it's going to go down to about, anywhere from around, 140-ish. So this is going to be an example, a crude example of moderate variability. It's around 10 beats per minute. Now, on the other side, if we go and we look just at this quick drawing, this would be something similar to minimal variability, because remember, for minimal, it's going to be less than 5 beats per minute. And if you look at this line, I mean, it's not really a lot of fluctuations here. We don't have a lot of movement there. So that's going to be my example of what minimal variability is. Now, also, if you take a look at these two examples that I have, remember your fetal heart, a baby's fetal heart rate, you want to see it in between about 120 to 160 beats per minute. So where we are in this example, we're in a good place. So if I see a strip that's looking like this, we're in a pretty good spot. We're doing really good here. But take a look at this one with this minimal variability here. Look at how I've done this one. We've got a heart up here of 120, 180. I mean, we're down here and almost, we're down here under the 100s here. So once we start looking at this, possibly running into bradycardia and some of these other things, this could be extremely problematic, especially with this minimal variability. So when we go back and we take a look at these, we look at absent, minimal, moderate, and marked variability. And again, I don't have marked here, but generally marked is going to be, like I said, it's going to be greater than 25 beats per minute. And that could be something like a possible umbilical cord compression could be getting you into that realm of possible marked variability. But if you've got absent or minimal variability and you combine that with late decelerations or prolonged decelerations, once you start putting these pieces of the puzzle together, this is what begins to give doctors and nurses and medical professionals notice that, look, something's not going right here. We've got to pay a close attention to this. We've got to start making some changes to see if we can help this baby out. Because like I said, we want to be in this area. We want to have a moderate variability. We want to stay within that 120 to 160. We want to be in a good place. Now, as this process goes on, sometimes you may have on the strip, you may have some dips. You may have some drops, or you may have, some things that go up, but as long as things quickly or they begin to get back into a nice range, it doesn't stay in the quote bad ranges for a considerable amount of time, more than likely things are going to be okay. So I know this is a lot more technical of a video that I'm talking about today, but I'm trying to help you understand these are the types of concepts. These are the types of things that birth injury lawyers are looking at when we are assessing these cases, when we're looking to find answers as to families as to, what may have happened or what may have caused their baby to have a traumatic brain injury. And it is critical that you understand, or that, the person that's doing these cases for you, that they understand these types of things with the use of medical experts and all of that. All right? So that's going to be it for today's educational video. Again, I'm Marcus Boston. Talk with you next time. Take care, guys.